Welcome everybody to today's webinar. NNPBC is very happy to present climate change and nurse solutions for action. Gosh, my goodness, could I do that any better? Yes, I could. Nurses and climate change, solutions for action. Thank you. We welcome Raluca Radu today, who I know has a passion for this topic. But before I ask you to, with me, take a moment to acknowledge the Indigenous people of the lands that today. While we meet on a virtual platform, I'd like to take a moment to acknowledge the which we BC conducts our work in BC. We acknowledge and unceded territories of the Inuit, Métis, and First Nations people that call this land home. Please join me in a moment of reflection. We can each in our own way move forward in a spirit of reconciliation and collaboration. It is indeed my pleasure to welcome you, Raluca, and to bring your expert knowledge to this topic and share it with us today. I want to give a special late night welcome to Belfast. It is late for you, sir. Don't stay up too late. Okay, Raluca, I turn this over to you. Thank you very much.
Hi, everyone. Thank you so much, Kim, for the really warm welcome. And good evening, good afternoon, good morning to anyone who's joining from different corners of the world. It is truly a pleasure to be here. I'm just going to start sharing my slides, so bear with me for a second. All right. Okay. So hope you should all be able to see my slides. And I just wanted to give a heads up in the event that my internet is cutting off. I will have to be, unfortunately, turning my video off, even though I don't like doing that. I like to be able to speak to my audience when I present. So hopefully there's no glitches, fingers crossed. So today's webinar is going to focus on nurses and climate change solutions for action. And I'm truly hoping to inspire those of you who are joining us today through the various examples that I can give in ways that you can get involved, but also hoping to provide information for you that is relevant and important for you to understand about climate change and about its impacts on human health. Prior to getting started any further, I do want to take a moment as well to acknowledge that the land where I live, work, and play is on the unceded and ancestral and traditional territory of the Coast Salish peoples, including territories of the Musqueam, the Squamish, and the Tsleil-Waututh nations. And to that, I give thanks each and every day. I also encourage you all who are from Canada, at least I know that the native-land.ca website is a fantastic place to find out from the lands from which you're joining us from. And so I encourage you to take a moment and do that as part of being a part of this webinar. So I actually want to start today's webinar with an icebreaker, and I would like to ask him to share the link to this icebreaker. In the meantime, I'm just going to be switching the sharing of my screen for a second here, because I would like to get a sense of a couple of things of the audience, most importantly. Just bear with me for a second here. Technology is always very interesting. Okay. And all right. So the first question is, what is your area of work? Of course, I assume most people on the webinar are in nursing, but if you're in any other profession outside of nursing, I'd love to get a sense of what that professional background is. And also feel free to share if you're practicing in a rural or remote setting, or if you're coming from an urban setting. It'd be really great to get a sense of who's part of the audience. Okay, we got education. And of course, these are completely anonymous. So nursing, oncology, urban. Okay, I'm gonna give it maybe 30 seconds. Public health and urban setting, innovation work and capacity building, public health, rural, urban emergency, street nursing, policy work, project lead, international nurse. Wow, students, education, very cool. Urban, NP student, innovation, urban. Okay. Right. A lot of public health and a lot of people from the urban settings, research promotion. Okay. Peds. All right. So that's great. That I really like to know where you guys are coming from, and hopefully that will give me a better sense as well when we engage in the Q&A session at the end. The next one that I am going to share. Sorry, just gotta go to my next one. Okay. Thank you for bearing with me. It's a new platform that I'm using for engaging people, so I appreciate the patience. All right, so what do you think about when you hear the words climate change? Now, feel free to use one word or two words, but definitely keep it brief. I want to just get a sense of what do you feel? What do you think? What are those initial thoughts that come to your mind when you hear these two terms? Human caused fear, doom, surmountable. Wow, okay. Anxiety, inequity, impact on minorities, the future, lack of resources. And of course, a lot of these might get bigger if there's similarities in answers. So I see fear is definitely big. Inequity and anxiety are huge. Disaster, crisis, urgency, definitely. Genetic changes, fear for children, loss of life, flooding, absolutely. Pollution elimination, parental guilt, that's a very difficult one. And as you can see, anxiety and inequity are really at the center again of this. So thank you for sharing that. I'm just going to close that browser and come back to my presentation. So thank you very much for being so open and sharing with me your thoughts and ideas. I think I just want to take a moment to acknowledge that when we talk about climate change, it is not a topic that comes easy for most of us, if not all. It is becoming a topic that is of high urgency, but it's also provoking a lot of anxiety. And so if any of the topics that you'll come across during this webinar can be disruptive or can be provoking or trauma-inducing for anybody who may have been exposed to such events, I do want to recognize that you may feel more comfortable stepping out because this is a time of crisis, because climate change is a shared crisis and it's also a health crisis. And when we talk about an event that is on a global scale, we really need to create spaces and platforms such as the one over here through this webinar to acknowledge those feelings and to try to come up with solutions that provide us with a sense of action. And we all know that action feels better than inaction, right? So now, since this webinar is focused on climate change and health impacts that are associated with that, I want to take a moment to let you know that I'm trying to focalize this on Canada, but also British Columbia more specifically. And I'm really hoping to hit the note hard home with nurses, because nurses are, after all, health professions, the largest amount of health professionals around the world. And I really do believe that nurses have a fantastic opportunity to enact in the space of climate change because of their large collective and because of their shared passion for taking care of people at the intersection of their health and well-being, but also of finding them in moments when they're most vulnerable. So I really do think that there is a strong opportunity right now for nurses to be a part of these spaces. Before we get any further, I do want to provide a little bit of a brief overview of climate change. And so climate change really refers to those long-term shifts in temperatures and weather patterns. What we know that the Earth's climate has actually always changed throughout history. And it's important to identify that there's two different categories of factors that cause climate change, and that they should be seen in those specific categories. So first, we'll see those that are naturally caused. So whether we look at things that are changing through internal climate systems, such as changes in the volcanic activity or the solar output or the Earth's orbit around the sun, and how that essentially affects the incoming energy. But of course, the biggest causes are those that are human-induced, that often you'll come across the term anthropogenic as well, so that's synonymous with human-induced causes. And so when we look back at the 1800s, that's really been the time in history when we started seeing the main drivers of climate change due to the burning of fossil fuels come about, so specifically that of coal, natural gas, and oil, and also due to the conversion of land for animal husbandry and agriculture. All of this has really in turn led to more greenhouse gas emissions coming out into the atmosphere that act as a blanket wrapped around the Earth. And that really contributes to trapping the sun's heat and raising temperatures, especially leading to high levels of pollution. And that essentially gets in our water and gets in our food and impairs our potential for having access to nourished food and safe water to drink, and in turn will have health impacts. And so really, since the beginning of the Industrial Revolution, we've seen the Earth actually warmed up about to 1.18 degrees Celsius, and there is additional warming underway. And we also know that the Paris Agreement, whose aim is really to hold the increase of global temperatures to a max of 1.5 Celsius, unfortunately, the current projections definitely show that we're moving past this threshold in the next coming years. What's also more alarming is that the rate of warming in Canada is actually double than that of the global average. And actually just between 1950 and 2000, we've seen the average temperature over land in Canada increase by 1.5 Celsius. And unfortunately, the projections show that over the next 100 years, the temperature is projected to rise another 1 to 5 degrees Celsius alone. So looking at climate change more broadly and impacts of climate change more broadly in Canada, it's important to outline that this will look differently across the different provinces. And so here in BC, for example, we have the outline of increased pests like pine beetle that would affect essentially forest productivity and would actually contribute to more fire activity throughout the province. We also see things like reduced glacier covers affecting western water resources and hydropower production. And also up in the north, we see the permafrost degradation that affects essentially the entire northern infrastructures that are there, which can contribute to more catastrophic and extreme weather events. And of course, if we look over to the eastern side of Canada, we see more increased temperatures that will again lead to more heat waves, higher sea level rise and increased coastal erosion, the changing of animal behavior and distributions, which would in turn affect food supply, especially for Indigenous populations who are highly dependent on that food to survive and for their well-being for both traditional purposes and the interconnectedness that they have with the land. Moreover, this is actually an image that comes fresh off the press actually, it's actually from the Health of Canadians in a Changing Planet and a Changing Climate that was released just last January. And as you'll note, this is more focused on the health authority level and the kind of impacts that are sensed across Canada. So if we look over here in BC at Comox, just St. Joseph General Hospital in 2014, because of the heavy rainfall that resulted in actually boil water advisories that lasted for 47 days. And that's a significant time out without having access to safe water that can just come up from the tap. In Interior Health alone, of course, because of the wildfires in 2017, and 2017 was a significant year that was quite destructive, that essentially led to facility closures, and not only that, but patient transfers and very high health risk air quality warnings that we saw from the smoke. And we need to remember that that smoke doesn't just sit in that specific region, but also travels far into other geographical regions, and hence will have an impact on the health and well-being of the people who are in close vicinity to that. And so it's really through this image, I just want to draw your attention that any kind of impacts that are happening and that are induced by climate change will automatically trickle into our healthcare systems and will hence impact the health and well-being that is essentially sensed by the people that we're caring for, regardless of the setting, whether that is in the acute settings or whether that is in the public health or community level settings. So we're really reminded that we need to be putting more emphasis on the adaptation measures, where we're actually trying to look at the actual or expected future climate by trying to reduce the vulnerability to harmful effects of climate change. And then through mitigation, trying to undertake more efforts to reduce and prevent the greenhouse gas emissions that are creating alternative storage in the atmosphere. And so it's important to focus on avoiding significant human interference with the climate system. over in BC, again, this is a recent publication that has come out just this year. It's from the Pacific Institute for Climate Solutions, and there was a team of well-versed researchers who contributed to this. But we can see what's in the forecast for BC in the years to come. And so again, looking at the different types of temperatures and precipitation levels, as well as how whether we're going to see more drought in certain areas or we're going to see less snowfall in areas that would normally see snowfall, it's important again to understand that these impacts will play a role in contributing to more extreme weather events, as we've seen last year specifically. In BC, we expect to see more extreme precipitation, more drought, more frequent and severe wildfires, more flooding. Sea level is expected to rise in the next couple of years, and that will put in peril communities that are living on the coast. The warming oceans will not only affect the ecosystems and the different fish species that are living there, but that will also affect whether people on land will have access to the fish that they've been raised with for years along their life. And BC's mainland alone is actually expected to see an annual increase of over 3 degrees Celsius by 2070. So that will actually lead to more heat events. In addition to this report, and I highly recommend the audience to look to try to at least peruse it. It's not a very long report, but what they found is that the COVID-19 pandemic has actually allowed us to pause and think about what is important, what are the priorities in our life, and it's also underlined where the inequities are and how frail our healthcare system are worldwide. And so the report really calls upon us to look to the future. And the 3 areas that they highlight, which I think are definitely areas that we should be investing more resources in, are first, telemedicine. They anticipate that telemedicine will actually lead to fewer inequities, especially if we're talking about communities that are living in the rural and remote settings, that would increase their chance of actually having access to following up with a healthcare provider rather than having to travel miles and miles away from their homes in order to see their doctors or their nurse practitioners. And of course, that will also lead to fewer carbon emissions. Additionally, another area that we're encouraged to look at is greening the infrastructure, so decreasing heat exposure, trying to increase mental health and well-being, because we know that nature does provide those incredible benefits for our well-being, not only in the short term, but also in the long term. And the next thing that we're encouraged to look at is how we consider food security. And so whether we talk about processing, producing, distributing, and even more so how we consume food and how we try to minimize our waste with respect to the food that we consume, not only in our homes, but also in our hospitals, that can actually lead to better outcomes for food security if we just take the measures that we need. So these 3 images are actually taken from last year, and we know that in BC, we've seen devastating impacts taking place that has affected people on an individual scale and all the way up into the community and beyond. The above picture is from the fires in Lytton. We've seen significant floods due to the mudslides as well, and the atmospheric river that took place in BC late last fall. And of course, the heat dome that was essentially broke all records in terms of temperature when Lytton hit 49.6 Celsius as the hottest spot. And we've seen, unfortunately, a substantial amount of deaths. Roughly, I know that the coroner had reported 595, but my understanding was that it was actually much higher than that. And unfortunately, that mortality was along people who were experiencing social isolation and people who did not have access to the resources necessary, especially when it comes to whether they were able to get to a cooling center in time or not. And so that's why I call upon you, when you think about climate change, to really consider it, the level of vulnerability of the people who are exposed. And so, it's important to understand that vulnerability factors can be present among different demographic and different populations and different regions, as we know, as well as whether people are experiencing different sociopolitical conditions and socioeconomic factors. And so that in turn will affect the level of vulnerability that they will have with respect to the exposure to extreme weather events, to heat stress, to the impaired air quality, and so forth. And in that, we have the health system capacity and resilience role that plays a substantial position in how people from different demographic settings and different geographic regions will experience those exposure pathways, and whether health systems are equipped with the workforce that is in adequate numbers, with the sufficient leadership and governance support that is necessary to provide the services needed for public and meet the public in ways that are equitable. And then, of course, we look over to the climate sensitive health risks, which I will dive into a little bit more detail momentarily. But just to outline that, we see with changing climate, we're going to see more vector-borne diseases, more non-communicable diseases. Mental health is going to be hugely impacted, as we have seen already as a result of this pandemic. And we will also see, unfortunately, more heat-related illnesses and respiratory illnesses, just to name a few. So when we zoom in a little bit more on the impact of climate change on human health and the exacerbation of existing inequities, these are several examples that I could just zoom in on one, and I could spend an entire hour just talking to one of these squares. But it's important to see that climate change affects a wide range of health outcomes. And so you'll notice that the most significant climate change impacts, such as rising temperatures, more extreme weather events, increasing carbon dioxide levels, their effects on exposure and subsequent health outcomes can result from in massive amounts in terms of the level of exposure and how people will experience those effects. So if we were to zoom in only on air pollution alone, we know actually that about 8 million people die annually every year because of poor outdoor air quality. And so it's important for us to try to figure out, again, through adaptation mitigation measures, what are ways that we can offer protection for people, regardless of their socioeconomic status. Similarly, if we see over in water and food supply, we notice that people will have higher levels of malnutrition or diarrheal disease. Same with water quality impacts. We notice in higher incidence of cholera, harmful algal blooms would actually take place, especially as we've seen during the heat dome last summer, and overall an environmental degradation that essentially can cause forced migration. It can contribute to conflict, and that will again have long-term mental health impacts and repercussions for people for years to come. And I usually like to zoom in on one particular example, and I wanted to use heat because, again, last year in the summer when we all experienced the heat dome here in BC, which I don't know about you, but for me it was one of those moments where I entered in a serious panic mode, and I feel like I've been in a panic mode to want to do more since. And as I mentioned earlier, we learned about how, for instance, air continues to be more polluted. But for instance, when we look at increasing heat events, we'll have different types of effects. And so when we look at health effects, we need to see the direct impact and also the indirect impact. And so we know that for people who experience heat illness, whether that was in the form of heat stroke or heat exhaustion or dehydration, we also need to understand how, for instance, hospitalization rates are going to have been climbing up and will continue to do so with more heat events. That will in turn also lead to potential risk of stroke, especially for people who are living with pre-existing comorbidities. But also indirectly, those specific hospitalizations that are increasing will also affect the delivery of health services provided. And so you'll notice here that it is stipulated that we've seen increased ambulance callouts and slower response times. And that has been a problem last year, not because people weren't able to get necessarily through 911, but there was just so many calls and so many people needed to be saved and rescued and taken to hospital that it was just impossible for the paramedics and the ambulances to keep up with the demand. The other thing to mention is, again, with respect to extreme heat events, is you'll notice there's an increased risk for accidents such as drowning. So if we take, for example, people who are going to try to get cool by going to the beach or going to the lakes, if they're dehydrated or if they've been consuming alcohol, that we know will essentially lead to severe dehydration, which can actually lead to fatigue and potentially fainting while they're in the water trying to swim. And that's why we will see those kind of accidents. And of course, for people who are outdoor health workers, or if they're construction workers and they're exposed to extreme heat, that will increase their chances of suffering from accidents and potentially going into the hospital. So it's important to make these connections, and it's important to see the relationship between environmental effects and the impact that they have on human health, because it allows us to better understand where our role as nurses, health providers, urban infrastructure professionals are situated on that spectrum. And again, it's important to understand how that role comes about when we interact with individuals and clients and patients in the community. So really, it's important to see that there's a myriad of health and social inequities that relate to our changing climate and that need to be taken into account. As you recall from your nursing studies, at least, that the social determinants of health are a specific group of social and economic factors that relate to an individual's place in society. And particularly wanted to focus on the top four of income, racism and discrimination, employment and education, because these are the social determinants of health that truly show that there's no that climate change has no boundaries, that there's no borders with respect to how it affects people from different backgrounds. And so it's important when we consider the social determinants of health to understand, for instance, how people who are less abled, who are pregnant or are already infirm with disabilities, or from climate migrants, or people who are already displaced or experiencing homelessness and marginalization. Children and the elderly, athletes and outdoor manual workers are going to be at a heightened risk with respect to how they will experience the impact of climate change on their health than people who may not necessarily be in those categories. And so when we actually look at climate change and health, we also want to adopt the three kind of layered view of micro level effects with the individual, the meso with what happens at the community level, and the macro, what's happening at the policy governing wide. And so if we take, for example, people who are affected by wildfires or flooding in their communities, we have to think about that idea of bouncing back, the level of resilience. How do we build resilience in those communities? And we know that people who reside in urban settings will, of course, have more access to potentially more resources, more healthcare, more community citywide, which will in turn attempt to support them as they cope with any losses or as they try to receive medical services in an immediate manner. On the other hand, though, people who reside in remote rural communities are unfortunately at a higher disadvantage and will more likely see those detrimental effects when it comes to how their health and well-being is coping. And so it's important to critically think about those social determinants of health and how they're in play. And again, context truly matters. And this also is a call to hold our accountability and also to advocate for the Indigenous populations to have better access to quintessential services. We know that Indigenous peoples experience significant disparities in their health as a result of having inadequate access to comprehensive health resources that can essentially support their well-being. And so, for example, here in Canada, certain communities throughout different provinces, especially Indigenous people, still have to travel very far to obtain medical services they need, or in some instances, they still live in areas that are under boiling water advisories. And so not having access to one of the most important necessities for survival, clean water, is not only going to continue to perpetuate the injustice, but also is going to continue posing a significant risk to health. And also during times of provincial emergencies, especially as we've seen with wildfires, a lot of the times, especially even with Lytton, there is a problem with how there's a lack of communication or a lack of immediate support that Indigenous peoples have voiced with respect to governments. And so we have to be accountable and advocate for Indigenous sovereignty and advocate for self-governance such that we can actually support Indigenous peoples to overcome the challenges that they're faced with. And when we talk about racism and discrimination, I wanted to also create space to mention that it's important to identify the role of environmental racism and how this is played out with respect to climate change and health impacts. Now, in 1982, the civil rights leader, Mr. Benjamin Chavez, has said that racial discrimination is in environmental policymaking, the enforcement of regulations and laws, the deliberate targeting of communities of color for toxic waste facilities, the official sanctioning of the life-threatening presence of poisons and pollutants in our communities, and the history of excluding people of color from leadership of the ecology movement. It is essentially environmental racism is a form of systemic racism, which essentially results from institutional policies and practices rather than individual beliefs and actions. And an example of this is actually present in Canada's Chemical Valley, which, as you'll note in this picture, is present in Sarnia, Ontario, where we see that the Chemical Valley accounts for about 40% of Canada's chemical industry. And really, we need to understand that the people who are living in the vicinity of all of these chemical plants and energy facilities, their health and well-being will not only suffer in the present moment, but it has done so generationally as well. And so we need to understand how this disproportionate siting of hazardous projects and polluting industries, especially among the Black, Indigenous, and other communities of color, play a role in the inequities that they experience, not only that they have experienced in the past, but that they continue to experience today. And again, this is another example. It comes from the same article that I read. It's from Al Jazeera. I'm happy to provide the links and sources afterwards for anyone interested. But I just wanted, again, to highlight that, for instance, Africville, which is essentially a story of the genesis of Canada's drive to combat environmental racism. And this is actually a part of in the Atlantic province of Nova Scotia, which is home to some of the earliest Black communities in our country. And we have unfortunately seen that they, again, are living in areas where there's toxic facilities, where there's an infectious disease hospital, a prison, a dump, and a slaughterhouse, all within the region where these people are living. And so that is another call for us to embrace a health equity and social justice lens at the core of this work, and constantly ask ourselves, is who may be differentially affected by particular impacts of climate change? Who isn't at the table and coming up with solutions? And how can we, especially if there's people, if we're talking about people who have roles in power, how can those people improve equity in addressing the effects of climate change? And so this has been an overview about some of the things that we are worried about here in Canada with respect to climate change and the health impacts that it follows, and also how people are disproportionately affected in a variety of ways. And as I transition towards the part of my webinar where I hope to gear you into action, I do also want to introduce you to a term that, although is emerging since about 2014 or 2015, it is that of planetary health. And planetary health is really the health of human civilization and the natural systems on which it depends upon. And so as you start to become more acquainted with this term, you might have seen it in the news, you might have seen it in different reports. I like to think of it more as seeing climate change, for example, as a symptom, kind of that falls under the larger diagnosis, which is planetary health. And usually when I think about planetary health from my own understanding, you can think of it as being the larger umbrella under which you have things like climate change, the water scarcity, biodiversity shifts, human health impacts, infectious diseases, and so forth, come together in this broad but important way of understanding these topics. Now, although, again, I said it's an emerging discipline based on transdisciplinary collaboration, it is also based on a collectivity of voices and expertise in finding and acting on solutions, both locally and globally, such that we in unity and in collectivism can actually respond to the ecological and climate disruption, to undo the harm and to create a desired future that is viable for generations to come. Because we know that only when humans thrive, as well as animal and plant systems thrive, and we know that our dependency on the health and well-being of all these systems that are all intertwined and which have a symbiotic relationship with one another. And so as we're moving towards the actions, I want you to think about the micro, meso, macro that I mentioned earlier. Again, the micro, it comes at the individual level. What can you do in your respective life, whether it has to do with changing the way you eat, or maybe trying to minimize how much you're driving if possible. So the kind of things that you're doing at the individual, versus the meso, which is basically the parts of the community, the group, the organizations at the middle layer. And then the macro, which is basically our society as a whole, especially in the political and economic and social realm. So this brings me to the last few slides, which I'm hoping that I've compiled a lot of different information because I really am hopeful to inspire action among all of you. So hopefully if I started with a very, very short brief about my story and how I came to be a part of this incredible space, an incredible community of people. I have essentially, throughout my graduate studies, when I was doing my MSN at UBC, I became very passionate about climate change. And I started asking questions as to why aren't nurses looking at climate change more? Why aren't they asking questions? Why aren't they actually trying to integrate some of these components into curricula? And I know that, for instance, in community and public health settings, the tone may be different, but when we talk about acute settings, I felt that there is a gap. And so for my SPAR, I actually developed a tool that is focused on essentially educating nurses in, not just nurses, but health professionals in any setting of the health impacts of climate change in a very short 4-hour sort of session. And so I've done that for my SPAR, and it was an incredible experience because throughout my SPAR, I also had the chance to work with the Association of Nurses and Nurse Practitioners of British Columbia on the position statement that has been up and it's due for revision very soon on engaging BC nurses with climate change issues. Because I think it's important, again, that the nursing voice is present at the policy table, at trying to influence change, at showing our expertise that we have and we've been trained into, not only through our BSN studies, but at the clinical settings as well. And so that has led me to take on various roles in different committees, writing up blogs and looking at how nursing fits in the realm of planetary health, having the chance to present for the ICN last year, which was an incredible honor, again, to showcase that nurses are already champions in everything that they're doing. We've already seen their insurmountable efforts that they've put throughout this pandemic, and we already know that they have the skills in place necessary to enact change, even in the climate change sphere. And I also had the pleasure of co-authoring a blog again with Helen Boyd just last November on the climate emergency and the climate practice now. And really, this could not have at all been possible without the support of the association, which is why, again, I want to use this time and space to say that I'm hopeful for those of you that are renewing your membership, that you are also becoming members of NNPBC, because the voice for nurses is represented by NNPBC. And that's how it's really empowered me to become a part of these spaces and to advocate for such topics, to be louder, and for nurses to essentially become disruptors of the status quo, to bring their chairs at tables, even if they may not be a part of those spaces yet. And the other thing to mention is that if you're a nurse educator, I really encourage you to consider revising or advocating for the revision of the curriculum to integrate these topics into sessions, whether it's about public health or whether it's about how we communicate. Rather than just solely focusing on therapeutic communication, we should also be focusing on risk communication and trying to think about how, for instance, that risk communication applies to science-based information, to health events, in order to promote informed decision-making. Which brings me to the next point that I want to say, that a great way to get involved if you're very interested or if you're at the beginning phases of becoming acquainted with environmental matters, the Canadian Association of Nurses for the Environment, or l'Association des infirmières et infirmières pour l'environnement, is a great place for you to join a community that has been incredible at advocating for nurses to be a part of climate change decision-making. They not only work to facilitate knowledge sharing and transfer based on environmental health principles, but they also support evidence-based environmental health practice. They influence policymaking and development, as well as legislation to support environmental nursing practice, and they promote educational and research opportunities for nurses. And I have had the pleasure to serve a 2-year term as Secretary of CANE, and I'm still a part of CANE, more active now in BC with CANE BC. But it's a fantastic place to get started, to get acquainted with amazing members, and to be a part of various committees. If you're interested in different topics, that space is there for you. And I strongly recommend joining of their initiatives and becoming a member with CANE. My busy slide is the slide that essentially encompasses, again, all the other different spaces that offer you the opportunity to engage in action. And so the first one that is up there is Green Care, which essentially, I don't know, for those of you who are a part of Fraser Health, Providence, Provincial Health Services Authority, or Vancouver Coastal Health, and I know that they're also doing some work with Island Health, they offered a chance for people who are working in different unit settings, or whether it's acute or public health, the chance to form green teams or to become green practice leaders. And they offer training sessions and ways that, what are you hoping to bring to practice that can essentially make practice more sustainable and that could give back to the environment as well. So that's a fantastic place to start if you're in a practice setting. Next is Cascades and the Center for Sustainable Health Systems, which is essentially has come together in partnership with Healthy Populations Institute at Dalhousie University, also the UBC Planetary Healthcare Lab, and the Canadian Coalition for Green Healthcare. And they've launched Cascades, which is essentially this multi-year capacity building initiative that addresses healthcare's contribution to climate. And they not only offer significant professional development opportunities, but they also offer the chance now, as part of their innovative kind of approaches to mitigating what's happening with the climate crisis, potential chances for healthcare workers to actually join some of their projects and put together proposals that can essentially make their spaces more sustainable. So I strongly recommend, again, if you're interested in becoming engaged, to connect with the Cascades team. I'm also well acquainted with them, so I'm happy to make the connections for you if you're interested. Again, for educational purposes, if you're interested in resources or further expanding your knowledge basis with respect to planetary health, the Planetary Health Alliance is, again, a great space to learn about the educational framework, which I think might be coming at a later webinar. Then you have the Canadian Coalition for Green Healthcare, which also provides support for people at the clinical settings to become champions for greening their healthcare practices. And they offer those supports for you to initiate your own green team. We have, of course, the Nurses Drawdown, which essentially is put together by the Alliance of Nurses for Healthy Environments from the US, which Kane works very closely with. And that essentially supports nurses from different specialties to take action in energy, food, mobility, gender equity, and nature-based solutions. And the Nurses Climate Challenge, which is essentially a global initiative that aims to mobilize nurses to educate health professionals about health impacts of climate change. So something similar to what I'm doing is something that you could also be doing in your practice setting. So you can sign up and become a nurse climate change champion. Then, of course, we have the PARX, Prescription for Nature. And I don't know if you know, but both general practice physicians, nurses, nurse practitioners can actually start prescribing nature for clients in different settings. You can actually, there's a way, if you go to their website and you sign up as a health provider, you can get your own prescription booklet, and then you can actually be prescribing that to your patients, especially when it comes to improving the mental health and their well-being. And CAPE, which is the Canadian Association of Physicians for the Environment, has a fantastic climate change toolkit for health professionals that walks you through the different stages of climate change and the different impacts, and also in various sectors as well. So I strongly recommend that, again, if you're wanting to begin your journey of acquainting yourself with the language and acquainting yourself with the impacts at a deeper level than I have gone in today. Also, lastly, if you become a member of the Global Consortium on Climate and Health Education, I'm a part of their Climate Change and Health Responder course. They have a plethora of free resources for people to, again, gain information in order to enact change in their practice settings. And I think I've failed to cover the other ones, but this is just a compilation of the different places where you can get started and to feel like you're actually a part of bringing about action into not only your personal life, but also in your professional one as well. I put together a list of documentaries of interest. I'm not going to cover them, but again, happy to share the slides with anyone who's interested afterwards. And just as I want to leave you off as I close off the presentation, but I want to encourage you to look up the Pledge for Planetary Health that unites health professionals in the Anthropocene. I think it's about a 2 or 3 page document, but this quote really resonated with me, and I hope it'll stay with you, because really, as mediators between science, policy, and practice, and also as trained communicators, health professionals are really well placed to become agents of individual and systemic transformative changes to increase the resilience to environmental changes and to reduce the ecological footprint of society. And so the pledge is really beautiful to take. I think it has to become a part of the oath that we take when we embark on the journey of looking after populations who experience vulnerability, who experience health inequities, and hopefully to drive us towards actually enacting change rather than just stay frozen and to feel like we're not able to make any changes, because it really does start with the individual, and then there's a domino effect from there. And hopefully this is a grounding quote for me. And when you think about why would I want to do this work? This is why, because the care of the earth is really our most ancient and most worthy, and after all, our most pleasing responsibility. And to cherish what remains of it and foster its renewal is our only legitimate hope. And I think that Wendell Berry couldn't have said it better than that. So this is my why, this is my how, this is my what. And I hope you've enjoyed my presentation. Happy to stay in touch with anybody who wants to reach out. And feel free to follow me on Twitter because I love to use that platform to connect with people. So thank you so much.
Wow, thank you, Raluca. That was fantastic. Talk about packed with information. Oh my goodness. And you were timed to the second. Wow. Professional, professional, professional. If anybody has any questions right now, please feel free to pop them into the chat box. There was some great resources already listed in the chat box as you were presenting to give a little bit more information. So we have Kane BC, we have Cascades, and Association of Nurses for Health and Environment BC chapter. So thank you very much, everybody, for adding some resources there to the chat box. If you have a question for Raluca, please feel free to pop it in there, or you can also use the Q&A section, whichever you're more comfortable with. Also, while anybody is thinking about their question, if you are 3 days out and you think, oh, I wish I had asked Raluca that question, don't worry. Send it to info@nnpbc.com and we will pass the question on to Raluca, or you can also send it on to me as well. Either way, we'll make sure, even if I have to go to her house and pin her down, I'll say, this is the question, and I'll do it. I'll do it for everybody. So you probably, if you can see the chat, Raluca, there's lots thank yous.
Yes.
And yeah, it was a fantastic, fantastic webinar. So glad that we cornered you into this.
So. Oh no, it's important, and it's my pleasure. And I think, and again, I know it's very hard to pack a lot of information. If I missed, I know I might have missed again vital statistics with respect to some of the, especially around the mortality cases that have taken place last summer with the heat dome. It's, you know, when you're putting together a webinar like this, it's so difficult to you want to include this and that, but you have to really provide kind of a very broad overview of what is going on, in the hope of, my hope is really just to encourage nurses to start being a part of these spaces. And like I said, I strongly believe that we are already championing so many different things. We're already pioneering in so many respective sectors. You know, nursing is such a beautiful, broad, holistic profession that allows individuals who identify, especially as nurses, to be a part of shaping and revolutionizing how we do health and how we provide health. And so same thing here, you know, the climate change crisis is an urgent crisis, and it really is the most urgent crisis that we have seen throughout the 21st century. And so now there's no better time than now to get involved and to gain the knowledge that you need in order to be a part of those spaces. So yeah.
Absolutely. As everyone might be aware, this webinar was recorded. It will be available on the public side of the website for probably about a week, and then we'll tuck it into the members only section. So if you're looking to rewatch that, or to glance through it again, or to share the link with someone, I'm going to give you about a week to do that and to access this great amount of information that Raluca has supplied to us. Yeah. Fantastic. No, I mean, a lot of thank yous, but no questions yet. So I think, okay. Question. We're all leaping on it. A question.
Is recycling part of hospital routine, in particular paper and plastics? That's a really good question. I mean, I can only speak to, well, when I was working at the clinical, at the bedside a few years ago, I know that it was part of a routine with respect to, at least I know, paper and some plastics, but I think I can't really speak to practicing nurses right now because I'm not sure what is going on at the clinical side. I know that some hospitals are trying to make more efforts. They're actually trying to streamline the different types of plastics and how those plastics are sorted versus just kind of dumping everything into the overall plastics. Because we know, I mean, I know in my household, we sort our hard plastics, soft plastics, and then you have a whole other container just for, you know, bottles and so forth. So I think that more efforts need to be undertaken with respect to minimizing that particular waste, because we know how much waste our healthcare systems produce, especially the hospital settings. And now even more so with the pandemic, we've seen that skyrocket, especially in areas around the world that are higher and more prone to inequities, and who are the least people who to contribute to climate change are the ones suffering from that the most. And I know that's been a part of the news as well, as to like where our waste is going and where the recycling is going. So thanks for bringing that up.
Yeah.
Oh,
Definitely.
yeah, definitely. There's always room for better, for more. I think there's always room to do more and to be better with respect to how we are citizens of this planet.
Yeah.
And if anything else, if there's any comments or questions that are sitting with you, again, I know I've put a lot out to people, and a lot of the information I provided it can be disturbing, and it can take time to sit with it. And so that's why I encourage you, please, by all means, feel free to email me or connect with me, because this is not a very easy topic to digest.
Yeah. Yeah.
Oh, wow. After the 1990 into 2022, and we're still looking into it. Yeah, that's definitely not a very positive response from something that you would have hoped to have transformed in so many years, in 30 years.
Yeah.
Thanks for sharing that, Shannon.
Yeah. Okay. Well, I am going to close and to thank Raluca one more time for that presentation. It's fantastic. So thank you very much, Raluca. And
no, thank you so much for having me. I really appreciate it. Thank you for providing this platform and just doing so much for nurses across the province. It's meant a lot to me to be a part of the kickoff series on climate change.
Yes, absolutely. You are more than welcome. All right. I hope everybody has a great rest of their day, and everybody takes care of themselves and of each other. All right. Bye-bye, everyone. Bye, Raluca.
Bye.